CEN test prep exam in California. Question 1. The purpose of administering surfactant to a patient with ARDS is to: Option A. Bronchodilate the airways. Option B. Reduce alveolar surface tension and prevent atelectasis. Option C. Decrease pulmonary capillary permeability. Option D. Increase mucociliary clearance. The correct answer is option B. Reduce alveolar surface tension and prevent atelectasis. Question 2. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates: Option A. A damage above the midbrain. Option B. A damage at or below the midbrain/brainstem. Option C. Damage to the cerebral cortex. Option D. A positive outcome. The correct answer is option B. Damage at or below the midbrain/brainstem. Question 3. The most common cause of acute renal failure in hospitalized patients is: Option A. Glomerulonephritis. Option B. Acute tubular necrosis. Option C. Renal calculi. Option D. Pyelonephritis. The correct answer is option B. Acute tubular necrosis. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Pulsus paradoxus is a classic finding in which condition? Option A. Cardiac tamponade. Option B. Pulmonary embolism. Option C. Aortic aneurysm. Option D. Congestive heart failure. The correct answer is option A. Cardiac tamponade. Question 5. What is the classic sign of a basilar skull fracture? Option A. Battle's sign, mastoid ecchymosis. Option B. Rhinorrhea with glucose minus negative fluid. Option C. Hemotympanum. Option D. All of the above. The correct answer is option D. All of the above. Question 6. The emergency nurse is caring for a patient with suspected pericardial tamponade. Which triad of findings, Beck's triad, is most consistent with this diagnosis? Option A. Fever, chest pain, friction rub. Option B. Hypotension, muffled heart sounds, distended neck veins. Option C. Hypertension, bounding pulses, headache. Option D. Dyspnea, crackles, pink frothy sputum. The correct answer is option B. Hypotension, muffled heart sounds, distended neck veins. Question 7. Murphy's sign is used to assess for: Option A. Pancreatitis. Option B. Acute cholecystitis. Option C. Diverticulitis. Option D. Small bowel obstruction. The correct answer is option B. Acute cholecystitis. Question 8. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide minus complex tachycardia at 220 bpm. What is the priority intervention? Option A. Administer amiodarone 300 mg for push. Option B. A synchronized cardioversion at 100 J. Option C. Immediate high minus quality CPR and defibrillation. Option D. A transcutaneous pacing. The correct answer is option C. Immediate high minus quality CPR and defibrillation. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. Ovarian torsion presents with: Option A. Bilateral lower quadrant pain. Option B. A sudden, severe unilateral lower abdominal pain with nausea. Option C. Painless vaginal bleeding. Option D. A fever and purulent discharge. The correct answer is option B. Sudden, severe unilateral lower abdominal pain with nausea. Question 10. Hepatitis A is primarily transmitted via: Option A. Blood and body fluids. Option B. Fecal minus oral route. Option C. Sexual contact. Option D. A contaminated needles. The correct answer is option B. Fecal minus oral route. Question 11. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate: Option A. No tetanus prophylaxis needed. Option B, a tetanus immunoglobulin only. Option C, Tdap or TD booster. Option D, a tetanus toxoid and tetanus immunoglobulin. The correct answer is option C, Tdap or TD booster. Question 12. A patient with chronic COPD presents with increased dyspnea. The nurse understands that the primary stimulus to breathe in these patients may be option A, elevated PaCO2. Option B, low PaO2, hypoxic drive. Option C, increased pH. Option D, elevated HCO3. The correct answer is option B, low PaO2, hypoxic drive. Question 13. A patient with a Le Fort 3 fracture is at highest risk for option A, dental malocclusion. Option B, airway compromise. Option C, corneal abrasion. Option D, temporomandibular joint dysfunction. The correct answer is option B, airway compromise. Question 14. What is the priority intervention for a patient with an open fracture? Option A, immediate surgical debridement. Option B, apply traction. Option C, cover the wound with a sterile saline minus moistened dressing and immobilize. Option D, administer analgesics. The correct answer is option C, cover the wound with a sterile saline minus moistened dressing and immobilize. Question 15. A patient with suspected bowel perforation should have which initial diagnostic study? Option A, CT scan with contrast. Option B, abdominal ultrasound. Option C, upright chest X-ray. Option D, colonoscopy. The correct answer is option C, upright chest X-ray. Question 16. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to option A, insert a urinary catheter immediately. Option B, perform a retrograde urethrogram before catheter insertion. Option C, irrigate the bladder with normal saline. Option D, prepare for suprapubic catheter. The correct answer is option B, perform a retrograde urethrogram before catheter insertion. Question 17. A patient bitten by a rattlesnake develops severe pain, swelling, and ecchymosis at the site. The priority intervention is option A, application of ice to the bite. Option B, incising and suctioning the wound. Option C, application of a tourniquet proximal to the bite. Option D, administration of antivenom, crotality. The correct answer is option D, administration of antivenom, crotality. Question 18. A patient experiencing a tonic-clonic seizure is in the emergency department. What is the priority intervention? Option A, restrain the patient firmly. Option B, insert a bite block. Option C, maintain airway and administer benzodiazepines as ordered. Option D, obtain a STAT CT scan. The correct answer is option C, maintain airway and administer benzodiazepines as ordered. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. The golden hour for acute ischemic stroke refers to the window for option A, completion of an MRI. Option B, administration of 4 thrombolytics, TPA. Option C, achievement of blood pressure control. Option D, initiation of physical therapy. The correct answer is option B, administration of 4 thrombolytics, TPA. Question 20. A patient presents with sudden onset worst headache of my life. The nurse's first priority is option A, administer pain medication. Option B, perform a complete neurological assessment. Option C, prepare for lumbar puncture. Option D, obtain a non-contrast CT scan of the head. The correct answer is option D, obtain a non-contrast CT scan of the head. Question 21. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to option A, patients with private insurance only. Option B, any person who comes to the ED and requests care. Option C, U.S. citizens only. Option D, patients with urgent conditions only. The correct answer is option B. Any person who comes to the ED and requests care. Question 22. A patient leaving against medical advice, AMA, must be informed of. Option A. They cannot ever return to this hospital. Option B. Their bill will be sent to collections. Option C. The risks and potential consequences of leaving. Option D. The police will be called. The correct answer is option C. The risks and potential consequences of leaving. Question 23. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes option A. Hypertension, bradycardia, headache. Option B. Abdominal pain, hypotension, and a pulsatile mass. Option C. Fever, chills, flank pain. Option D. Dysuria, frequency, urgency. The correct answer is option B. Abdominal pain, hypotension, and a pulsatile mass. Question 24. The initial fluid resuscitation bolus for a patient in septic shock, per surviving sepsis campaign guidelines, is option A. 250 ml of 0.9% normal saline. Option B. 500 ml of D5W. Option C. At least 30 ml/kg of isotonic crystalloid. Option D. Packed red blood cells to achieve a hemoglobin of 10 g/dl. The correct answer is option C. At least 30 ml/kg of isotonic crystalloid. Question 25. Which finding on end-tidal CO2, EtCO2, monitoring indicates successful endotracheal intubation? Option A. EtCO2 of 0 mmHg. Option B. Persistent EtCO2 waveform with each ventilation. Option C. PtCO2 of 50 mmHg. Option D. A flat line waveform. The correct answer is option B. Persistent EtCO2 waveform with each ventilation.